specialist, Dr. James Mueller. Welcome to the show. Nice to see you.
Nice to see you too.
And before the show, Dr. Mueller, he introduced himself to me as Jimmy. So it's cool. It's really, I feel very comfortable talking to you, not just because of that,
Thanks.
but the bow tie. That's very, I think that's very welcoming, when you're, dealing with somebody who's, fearful of what might be happening to them health-wise.
Yeah.
To see that friendly face with a bow tie.
Yeah. And there's been so much in our schooling and so much in the news about like being a nice person, I guess you could say, and having a welcoming atmosphere. And this is just my way of trying to do that on a professional basis.
I like that.
Yeah, I usually ditch the white coat. I don't like wearing a white coat. Number one, it just makes me really hot. So that's why I generally don't like to wear it, because I generally run very warm and I don't want to be super sweaty. And I've been wearing a bow tie since probably since residency. And
it's your trademark.
Yeah, it's one of them.
Yeah, it's like, I want to see the guy with the bow tie.
Yeah.
And you have a specialty. I think it's very interesting. Foot and ankle.
Yeah.
Orthopedics. What inspired you to specialize in foot and ankle orthopedics?
So orthopedics, just in general, in our training, right? We go through so many different areas of the body in terms of the full musculoskeletal care. We're talking, hand and wrist, shoulder, elbow, spine, hip and knee replacements, sports medicine, ACL reconstructions, pediatric orthopedic surgery, and then I just found that in the foot and ankle space, it was all of orthopedics in a small area. Mm-hmm. And that's what I liked, because I like doing it all. And so that kind of allowed me to continue, quote unquote, doing it all, because it was sports medicine, dealing with athletes with torn ligaments and ankle sprains. It helped me deal with arthritic problems like ankle replacements or ankle fusions. It helped me deal with broken bones, people that are getting injured, ankle fractures and foot fractures. So it was a great meld of all of orthopedics in a small area.
To me, it seems like a broken ankle. It's rare. You don't hear that much. But on TV, like on Sunday,
mm-hmm.
the Giants game, running back Cam Scottaboo, he had a horrible injury. They couldn't even show.
Yeah, it was pretty bad.
Yeah.
I took a look at his foot was pointing 90 degrees from where it should be pointing. So
ouch.
It was not good.
They said right away, he's not going to be playing football this year at all.
Mm-hmm.
And according to the reports from sports media today, it's not just a dislocated ankle, fractured fibula, ruptured deltoid ligament. That sounds like there's a lot going on.
Yeah, those are the support structures around the ankle. The bony structure being the fibula, and then the ligamentous structure being the deltoid. When both of those are gone, it's tough for the ankle to stay in its joint. It gets dislocated.
Yeah, his foot looked like it just bent right off. Ouch.
Yeah.
So that's not that's not very common. What are the more common foot and ankle problems you see?
On a daily basis, I see a lot of people with ankle sprains. Most of the time, those get better without me. We can get them to, when I say without me, I mean without surgery. They can get better on their own.
Like you rolled your ankle.
Sprained your ankle. I see a lot of those. I see a lot of patients that stub their toe on a bed frame in the middle of the night, that either break their toe or hurt it really bad. And then I see a decent amount of people with arthritic problems, ankle arthritis, foot arthritis, and then some people with foot deformities, such as someone with a flat foot or someone with a high arch, and the tendon problems that are involved in those.
So we have, as things like arthritis, as you age, we're going to have more foot problems.
Mm-hmm. I would say the best thing to help your foot feel better, I don't think there's a way to prevent arthritis once the arthritic pathway starts. There's no way of preventing it or restarting the pathway. We haven't figured out a good way to regrow cartilage. And that's essentially what arthritis is when there's when the cartilage is not functioning very well anymore in the ankle in any joint. And so what we've found, we as in the foot and ankle community have found, is just wearing good shoes tends to help most problems.
Really?
So as opposed to things that are comfortable and everyone likes to wear, slides, flip-flops, Crocs, they're good, they're convenient, but they don't have a lot of support to them. What I tell my patients in the office is if you're looking for a good shoe that's going to support your foot, grab the shoe by the toe, grab the shoe by the heel. You should not be able to bend it in half. If you're able to bend it in half, it's probably not supportive enough for someone who's got foot pain. Now, if you want to wear your nice shoes out one night and you're going to the bar, you're going out with your friends, cool, that's great. But just realize you might be paying for it the next day.
Yeah, so you're going to any high school, you're going to see 90% of the kids wearing slides, hey dudes, Crocs. They're universal.
Yeah, they are.
So wearing all of these types of shoes now, is it going to lead to problems in later years?
I don't think so. I think first of all, I don't think there's any study out there that's going to show that correlation. But just from a biomechanical standpoint and from a longevity standpoint, we kind of learn as we age and things that are good ideas and bad ideas. And the slides that are comfortable in your early years, there's a reason you don't see a lot of us wearing slides.
Yes.
On a day-to-day basis.
Right.
They don't work so well for workplace.
Well, I think as we get older, we're more concerned, with balance, tripping and falling, and if you have some
it's going to slide off your foot all the
yeah.
time. I take a decent amount of call over at the hospital too, and so I see a lot of people that feet get caught in the middle of the night on a rug or on the slippers, and they fall, and they unfortunately maybe break an arm, break a hip, break a leg, and that happens too.
We hear about people with diabetes who
they don't feel their feet.
They
don't feel their feet.
They don't feel their feet. And some people, they lose there's amputation because
they don't lose it because they can't feel their feet. And when you can't feel your feet, you don't know when there's a pressure. You don't know if you've got like a hot spot or something on your foot. And if you're not looking at your foot every day, you're going to miss it. Which can be a big deal.
And I'm surprised to hear that. I've figured that when you have a limb, something amputated, is because it's going to cause you, it'll make your life worse, and it sounds like it's more of a safety issue rather than a health issue for the foot. For the foot,
yeah. And the people with neuropathy, and there's other reasons people have not being able to feel their foot besides diabetes. There's other reasons people have neuropathy.
Oh, I know people with neuropathy too.
Yeah, some people get neuropathy from chemotherapy. Some get them from strokes. Some have them from just like chronic alcohol use or some vitamin deficiencies. It's not just diabetes, and they can have the wreck that can cause on your foot from not being able to feel it. It can cause a lot of things. I mean, you could get an infection from having those ulcers there,
and you don't know it.
And you don't know it until you feel sick.
Go ahead. They feel like there's pins, people sticking in the bottom of their foot.
Yeah, and that's what neuropathy is.
Wow. So are there some treatment options for various chronic ankle pain or instability?
Chronic pain, ankle pain. If you're able to take any kind of anti-inflammatory medicine, so what that means is Tylenol is a great drug. It's not an anti-inflammatory drug though. So that means something along the line of a NSAID or an ibuprofen, Aleve, or a naproxen type medicine. If you're able to take it, those tend to help. As far as footwear goes, kind of what I talked about, something that's nice and stiff and rigid and has a decent amount of cushion. And if you need a little bit more than that, go to any type of drugstore, the internet, and grab an ankle brace, just a lace-up one.
Are there some surgical techniques and technology? I think a lot of people, when they hear about ankle surgery, they get scared because it's different today than it was 20 years ago.
Oh, for sure. The technology in the last 20 years in terms of ankle arthritis is completely different. And the difference between ankle arthritis and like hip and knee arthritis is that most times ankle arthritis is due to an injury. So my patients with ankle arthritis are a lot younger than my colleagues who deal with hip and knee replacements. And getting someone an ankle replacement who's in their 30s because they have a bad ankle because they fell off a ladder and shattered their ankle is a different story than someone who's in their 60s or 70s and who needs a hip and knee replacement. Hip and knee, these are all mechanical devices. They're going to fail at some point. The idea is that hopefully that you only have one of these in your lifetime and not multiple.
That was the design, by design.
Mm-hmm.
We hear about runners,
Mm-hmm.
not ankle, we hear about knees and hips for runners. They wear out. Does that happen to runners too, on the ankle?
It does. It's more rare though.
And how does someone know whether they should see a specialist or it's just something that's going to go away?
If the pain doesn't go away. The pain doesn't go away. Infections are, like if you're a diabetic or someone who's got neuropathy and you've got a red hot swollen foot, you probably should go get that checked out. You have an injury and the pain's not getting better in the time that you think it should get better.
Something like stubbing your toe or stepping on a Lego, that's going to go away.
That's going to go away, yeah. You sprain your ankle and you're like, oh, I just rolled it. It'll get better in a couple days. And it doesn't get better in a week or two. And you aren't able to literally put any weight on it for a couple weeks.
You guys are right here in Jackson?
Yeah, right down the road.
Where's your practice?
I'm at the 1201 building.
Nice.
Right across the street from the hospital.
Great, and you're fairly new to Jackson.
Yeah, I've been practicing here in Jackson now since, I think last September was my start date. It's been busy.
Welcome to Jackson.
Well, thank you. It's been great here.
Thanks for coming in today.
Yeah, for sure. Thanks for the invite.
You bet. Foot and ankle orthopedic specialist, Dr. James Mueller, part of the team at Henry Ford, and this week's special guest on Wellness Wednesday, presented by Henry Ford Health. We've got lots more coming up on the show today. We've got some old time